Sleep apnea. Sleep apnea is a serious sleep disorder characterized by repeated breathing pauses during sleep. This condition occurs when the airway becomes partially or completely blocked, leading to a decrease in oxygen levels in the body. This can result in disruptions to sleep and lead to a variety of symptoms, including loud snoring, gasping for air during sleep, and excessive daytime sleepiness. There are 3 types of sleep apnea, which is 1. Obstructive sleep apnea or OSA. This is the most common type of sleep apnea and is caused by the partial or complete blockage of the airway during sleep, typically due to the relaxation of muscles in the throat. 2. Central sleep apnea or CSA. This type of sleep apnea is caused by a failure of the brain to properly signal the muscles that control breathing during sleep. 3. Mixed sleep apnea. This is a combination of both OSA and CSA, and is also known as complex sleep apnea syndrome. In this type of sleep apnea, a person may have periods of both obstructed breathing and abnormal breathing patterns due to neurological causes. The causes of sleep apnea can vary depending on the type of sleep apnea. Other risk factors for sleep apnea include family history, male gender, and a history of smoking or alcohol consumption. Sleep apnea can also be more common in people with certain medical conditions such as diabetes, high blood pressure, and obesity. What are the symptoms of sleep apnea? The symptoms of sleep apnea can vary depending on the severity of the condition and the type of sleep apnea. You usually won't notice your first symptoms of obstructive sleep apnea. Instead, your bed partner may make you aware of them. Some common symptoms of sleep apnea include loud snoring. This is a common symptom of obstructive sleep apnea, but not everyone who snores has sleep apnea. Breathing pauses. A person with sleep apnea may experience episodes where they stop breathing during sleep, followed by choking or gasping sounds as they resume breathing. Excessive daytime sleepiness. Sleep apnea can cause disruptions to sleep and lead to excessive daytime sleepiness, even after a full night's rest. Fatigue. People with sleep apnea may feel tired, even after getting a full night's sleep. Headaches. Frequent morning headaches can be a symptom of sleep apnea. Restless sleep. Sleep apnea can cause a person to toss and turn during the night, making it difficult to get restful sleep. Mood changes. Sleep apnea can cause irritability, mood swings, and difficulty concentrating. High blood pressure. Sleep apnea can increase blood pressure and lead to other cardiovascular problems if left untreated. If you are experiencing any of these symptoms, it's important to talk to your healthcare provider to determine if you have sleep apnea or another sleep disorder. Are you at risk for sleep apnea? There are several factors that can increase your risk of developing sleep apnea. Some common risk factors include a large neck circumference that could make your airways more narrow, being overweight, use of alcohol, sedatives, or tranquilizers, being male, older age, narrowed airway that you inherited or developed from large tonsils or adenoids, family history of sleep apnea, smoking, medical conditions such as type 2 diabetes, congestive heart failure, high blood pressure, Parkinson's disease, PCOS, hormonal disorders, prior stroke, or chronic lung diseases like asthma, and nasal congestion. How do doctors diagnose sleep apnea? There are several methods that doctors use to diagnose sleep apnea. The most common method is a sleep study, also known as a polysomnogram. A sleep study is typically conducted overnight in a sleep clinic or at home using portable monitoring equipment. During the study, sensors will be placed on your scalp, face, chest, and legs to measure brain activity, eye movement, heart rate, oxygen levels, and muscle activity. This information is used to determine if you have sleep apnea and to assess its severity. In addition to a sleep study, your doctor may also ask about your symptoms and medical history, perform a physical exam, and review any medications you are taking. They may also recommend additional tests such as a blood test to check for underlying medical conditions that may be contributing to your sleep apnea. Once diagnosed, your doctor will work with you to develop a treatment plan based on the severity of your sleep apnea and your individual needs. How is sleep apnea treated? There are several treatment options available for sleep apnea, and the best course of treatment will depend on the severity of the condition and the individual's needs. Some common treatments for sleep apnea include 1. Continuous positive airway pressure or CPAP therapy. This is the most common treatment for sleep apnea. It involves wearing a mask over the nose or mouth during sleep, which delivers a continuous flow of air to keep the airway open. 2. Oral appliances. These are devices that are worn in the mouth during sleep to reposition the jaw and tongue to keep the airway open. 3. Lifestyle changes. This can include losing weight, avoiding alcohol and sedatives before bed, and changing sleeping positions to reduce the severity of sleep apnea. 4. Surgery. In some cases, if other treatment options don't help, your doctor may suggest surgery to remove excess tissue from the throat or to reposition the jaw. Possible surgeries include tissue removal, tissue shrinkage, jaw repositioning, implants, nerve stimulation, tracheostomy, or creating a new air passageway. Surgery to remove large tonsils or adenoids and weight loss procedures may help lessen snoring and help with the overall treatment of sleep apnea. 5. Breathing devices. These devices may be used to help regulate breathing during sleep, especially for individuals with central sleep apnea. 6. Medications. Certain medications may be prescribed to help improve sleep quality and reduce the severity of sleep apnea, although this is less common. It's important to work with your doctor or health professionals to determine the best course of treatment for your individual needs. Untreated sleep apnea can have serious health consequences, so seeking treatment is important for both improving sleep quality and overall health.